Hi everyone, Julia here from the FullWell team. Welcome back to the Knowledge Well. We're back again with my good friend, Dr. Brittaney Cook, who is a mom of two and an expert in all things pre and postnatal fitness. Today we're going to talk with her about pregnancy fitness, so how to train for pregnancy, what some common myths and misconceptions are. And then we're going to go through a really nice little set of modifications that you can use as you progress throughout your pregnancy, and a great little 10-minute circuit that you can either do really quickly just to get some movement in, or double, triple, quadruple up to get a full workout in for the day. Now, in our preconception special with Dr. Britt, she went over some really great tips and coaching on proper breath work and pelvic floor work. So if you haven't checked that one out, press pause, go back and do that one first.
All right, let's talk about pregnancy fitness. So as somebody who trains pre and postpartum women, I would say the most common misconceptions that I see are, number one, that women cannot lift heavy when they're pregnant. Number two, that you can only get your heart rate up to a certain number. And number three, that you have to modify every single exercise. So what's the point of even exercising when you're pregnant? So if you're worried about lifting really heavy when you're pregnant, it's important to speak with a professional. So find somebody who specializes in pre and postnatal fitness. And if you've been lifting weights before you got pregnant, it's quite possible you can lift those same exact weights throughout your entire pregnancy. Of course, talk to your doctor about it. Every pregnancy is different, but don't be afraid of picking up some dumbbells. Misconception number two, you cannot get your heart rate above a certain number. Of course, this is going to be specific for every single pregnancy, but just keep in mind that towards the end of your pregnancy, something as simple as bending over to tie your shoes is going to increase your heart rate. So it's important to become aware of what does spike your heart rate early on in your pregnancy and what feels normal for you. And I would say to never fully rely on your heart rate trackers, because there's a lot more blood flow in your body when you're pregnant, and it takes a little bit of time for those to adapt. So don't rely on the numbers on your watch, but be very aware of your perceived effort and your perceived heart rate. So listen to your body. Number three, certain movements or all those movements have to be modified. Not true. There are definitely a few modifications that we make throughout a pregnancy workout routine, and there are very specific ones, but your body will definitely tell you if you need to modify a specific movement. First modification I would recommend is around 15 to 20 weeks to avoid laying face up with your heart and your hips level. So what that would look like is when you traditionally lay on your back, trying to avoid this position here, and a great modification for that is to get your heart above your hips. So using something like a bench or a pillow or this beautiful ottoman to elevate your heart above your hips is a much safer posture to be in. Second modification would be to avoid any pressure that's forward on your core. So something as simple as a front plank position where you're really using your core and challenging your rectus abdominals. Try to avoid this and transition to more of a side plank position. So much safer on your rectus, gravity is not working against you. You can use your obliques, transverse, and still maintain tension in the rectus in a safe way. Of course, always breathe through all of your core exercises. Third modification I would recommend is to take anything that's externally rotated. This is primarily more towards the third trimester, towards the end of your pregnancy, and to pull everything into a more neutral position. This is going to help avoid something called symphysis pubis, and it's pressure and pain through the front of your pubic bone. So we want to basically try to close through your pelvis and close through your hips. Last modification I would recommend, this again goes towards the end of your third trimester, more towards the last few weeks actually, is to avoid lifting high and instead transition your weights down low. So in order to avoid too much pressure pushing downward on your pelvic floor, try to take your weights, for example, through a squat pattern and move them down to your sides so they're below your pelvic floor. A much safer way of loading that won't challenge your pelvic floor too much.
Julia again, here to help out. Just like in Britt's other workouts in our series, she's going to walk you through movements and I'm going to talk you through them. So you only need 1 or 2 dumbbells, maybe even a kettlebell or a long band for this one, but you can definitely do it just body weight. Here's a list of exercises if you want to just have at it yourself, but together we'll be working through about 10 minutes of work, and every minute on the minute, you'll start in with 45 seconds of a movement and take 15 seconds to rest. So let's go ahead and start with our squat pattern. If you're using a weight, grab a weight, and then just like Britt, you're going to stand with your feet just a little bit wider than hips, maybe even shoulder distance apart. You'll turn your toes out maybe slightly, but in general, your knees are going to want to track parallel over those toes. See how she's sitting straight down into that squat, keeping her chest nice and high. Big deep breaths out. And her back, her spine is going to stay neutral. You'll see that she hits that position every single time. That red line is kind of outlining where she's trying to go with her back. Let's go ahead and try it. First round, 45 seconds. We'll do it twice. So here we go. Down into the heels, pushing up through the heels and through your big toe, through the ball of your foot, right? So you're feeling your quadriceps, the front of your legs, activate, as well as some of your glutes and hamstrings, that back body. One of my favorite things about a front-loaded squat exercise, meaning we're not holding the weight on our back the way that some people would do like a barbell squat. We've got the weight in front of us. That's going to be a nice challenge for your core. So again, as you progress throughout your pregnancy, if that's feeling uncomfortable, go ahead and just ditch that weight and keep with the squat. Let's take a rest in 3, 2, 1. Take 15 seconds and just shake it out. We'll do that one more time before we move on to a more upper body core movement. In 3, 2, 1, we go again. I really like to think about pulling your collarbones wide, your shoulder blades behind your back together so that everything stays nice and open in the front. And you can see that Britt isn't hiking her shoulders up toward her ears to keep that weight up. She's got them nice and relaxed. I always like to say, make sure you have room for a pair of chandelier earrings to dangle and shine. As you can imagine, my male clients absolutely love that one. See if you can get in another 1, 2, maybe even 3 really solid reps. And then we'll rest and move on in 3, 2, and 1. Now we're going to move on to our plank exercise. And remember, as you progress throughout your pregnancy, you're going to want to just switch over to side planks so that you're not getting all of that force on your belly. So, and Britt here is doing a fantastic modification. Her hips are totally stacked, as you can see. And then she's one long line from her elbow on the floor to her top hand. And she's actively pulling that elbow on the floor toward her bottom knee. Let's try it. So we'll pop up and hold this plank. Everything is aligned. Shoulder right over the bottom shoulder, right over elbow. Chest is nice and wide. Her left ear is off her shoulder, providing a lot of long length in her neck. And she's taking a modification on her knee. She's still getting all of that nice work in the left side of her core, and she's even kicking it up a notch and making it more challenging for herself by picking up that right leg. So she's got a little bit of hip action, a little bit of abductor action in that right top leg. Core is tight, hips are staying squared. We're gonna rest in 3, 2, 1, and recover. Now we'll switch sides. Flip on over to that other elbow, stack your shoulders, stack your hips, and let's pop it up. The reason that I love this modification that Brittaney is doing is because she's pointing out that a modification doesn't always equal a regression, right? Especially if you're a seasoned athlete. Sometimes modifying as your body is changing throughout pregnancy feels like you're becoming less fit, or you take it as some sort of sign that you're kind of like losing fitness as you go. And it couldn't be further from the truth, right? We're just modifying to make ourselves more comfortable in the body that we're working with right now. She's also throwing a progression on top of her modification and lifting that leg. So there are lots and lots of ways to work. And take a rest. 15 seconds, and we'll move on to our next exercise. Make sure you're breathing. Make sure you're grabbing some water when you need it. We're going to go for an upper body pull now. Right here, Britt is kneeling. Her core has to stay turned on in order to keep that nice angle from head to tailbone. And she's got that really nice drop from her ears down to her shoulders. We could definitely see her earrings, and she's just pulling straight down, alternating. Let's try it. You don't necessarily have to have a band or somewhere to place it overhead for this one. You can always use a resistance loop and hold it up with one side and go side by side, alternating, or you could do it without weights. These small muscle groups in your back and your posterior deltoids, the backs of your shoulders, get plenty of work from just pulling with no weight too. And the deeper you make that angle and leaning forward, if you have no weight, the more tension you're going to be placing on those muscles. So you can kind of increase the weight, the force of gravity as you go. Take a rest in 3, 2, and 1. Now it's really important to remember to breathe through these, especially every time we lean forward. Even when we're not working out, we tend to just kind of let go of the core, right? It's pretty natural. Let's try again and see if we can keep the core super engaged by connecting it with our breath. Big inhales through the nose, and then exhale through that straw, just like Britt taught us in her first preconception video. Again, if you haven't seen the preconception workout video, I would go back and look at that. She gives some really great tips on how to connect with your breath. For example, you want to think about breathing out through a straw, a really small-ish opening in the front of your mouth. And if you almost pretend as if you're coughing every time you breathe out, it makes for a really effective exhale to power these movements. Nice work. In 4, 3, 2, and 1. Recover, and we'll go into our next lower body exercise. You can do it with weights or without. Let's take a look. Britt's going to grab her kettlebell or her dumbbell, and she's going to take a sumo stance so her feet are very wide. They're going to turn out. So she's pointing her toes maybe out to like 10 and 2. And she's taking a hinge pattern this time. Her back is staying nice and neutral. She's sitting her glutes back, and every time she comes up, she's back upright. So it's less of a huge bend of the knees like that squat, and more of a hinge. The biggest difference between hinge patterns and squat patterns is that our hinge is going to focus on that posterior chain just a little bit more, right? It's a functional movement. So she's keeping her chest nice and open. As she dips down, she's reaching that weight back between her ankles, between her heels. So she really gets that hinge in. She almost hits parallel with her back. Really nice. And as you can see, she's doing that big productive exhale as she comes up. Break in 3, 2, and 1. I love a sumo deadlift because it also engages your inner and outer thighs, your hip adductors and abductors. So there's a really nice stability element there. Let's go for the second set. Remember from earlier when Britt was giving us modifications for our bellies as they get bigger throughout pregnancy, as you start to show more and more, this might become really uncomfortable for you to stay in this turned down position. So what you'll want to do is simply bring your feet into parallel Turn your toes more inward, facing right in front of you. You might bring your feet, your stance, a little bit closer and take the same exact hinge pattern that way. You can also split weights up. You might just take 2 dumbbells so that you can hold them at your side and you don't feel like you're bumping into your belly. Let's recover. I can't believe it. We've already made it to the last final exercise in this little 10-minute circuit. Now we're going to go for an upper body push motion, which is going to work pectorals, triceps, biceps, all the goodies up top. So Britt's going for a chest press with a band. And again, you don't necessarily need a band like this and a setup like this to make this one work. Her chandelier earrings would be right there. She is a perfect jewelry model here. We could even throw a giant necklace on her and see everything sparkle. Let's give it a try in 3, 2, 1. So if you don't have a band for this one, you can grab a set of weights, maybe smaller weights, and just take your push out. That'll be a little bit more deltoid action, top of the shoulder, that shoulder boulder, but you'll still get some nice push there. So this first set, she's got one foot in front of her bracing. Again, this little lean forward means that her core is on. It's almost like a faux plank setup, right? She's just a little more activated through the front of her body. Her ribs are tucking down toward her hips to keep her spine nice and long and neutral. And again, she's got all that space between her ears and her shoulders, so she's not stressing out her upper traps. 3, 2, 1, recover, and we'll do it one more time. If you're someone who's really obsessed with staying even, you'll want to just switch legs for the second round to make sure that your core is getting a little bit more balanced. Think about changing up how you're punching. I like to call it a punch, even though we're chest pressing. You can press both arms at the same time for a little more work. You can alternate like Britt is doing. She's flipping her palm down, which is definitely getting more into her medial deltoid, her shoulder. But if you want to keep your thumbs up and punch, that'll be in the front of the shoulder, the anterior deltoid. You could also turn your palms straight up and get a little bit of bicep work going here. Three, 2, 1. Amazing work. Big inhales, big exhales. And remember, you can leave it at 10 minutes, or you can double up, triple up, quadruple up. Keep that workout going as long as you need to feel a good sweat and feel like you've really done some good work. Here's that list again, just in case you need it. And like we said, definitely make sure you check out Brittany's preconception workout and know that a postpartum workout is coming your way. We'll see you guys next time in the Knowledge Well.